let's talk about diphtheria. Now, I know what you might be thinking. That sounds like something out of a history book, right? But this bacterial infection is still very much a clinical reality. And here's the twist. The real danger isn't the bacteria itself. It's a powerful toxin that it unleashes inside the body. So, what exactly does toxin-mediated mean? Well, picture this. The actual infection might be stuck in one place, like your throat, but the bacteria are like little factories pumping out a poison that gets into your bloodstream and travels everywhere, causing serious damage far from where it all started. That's what makes diphtheria so incredibly dangerous. So here's how we're going to break it all down. First, we'll cover the basics of diphtheria. Then, we'll meet the tiny culprit behind it all. After that, we'll get into the signs and complications, how doctors race to treat it, and finally, we'll talk about our #1 weapon against it, prevention. To really get a handle on diphtheria, you have to think of it as two things happening at once. First, there's the infection itself, and second, there's the intoxication. The bacteria might just hang out locally, but that exotoxin they produce, that's the long-range weapon that causes all the systemic trouble. The whole thing usually kicks off in the upper respiratory tract, and this is where it creates its most infamous telltale sign, a thick, grayish-white layer called a pseudomembrane. And trust me, this is no ordinary coating. It's a tough, leathery mat of dead cells, fibers, and bacteria that can literally choke a person. All right, let's pull back the curtain and meet the organism actually causing all this chaos. We're talking about a bacterium called Corynebacterium diphtheriae. So under a microscope, this bug has some pretty distinct features. It's a gram-positive, club-shaped rod, and when they group together, they form these cool patterns that look kind of like Chinese letters. But here's the absolute key takeaway. Not all strains of this bacteria are dangerous. The disease diphtheria is only caused by the strains that can produce the toxin. No toxin, no disease. And this right here is a perfect example of what we mean by gram-positive. See that deep purple color in image B? That's a classic hallmark of C. diphtheria, and it helps lab techs tell it apart from gram-negative bacteria. It's a really crucial first step in identifying our culprit. Now, this is where the story gets really wild. The bacteria's main weapon, this powerful exotoxin, doesn't even originally belong to it. The genetic recipe to build the toxin is actually carried in by a virus, a bacteriophage, that infects the bacterium. So think about that. It's a virus-infected bacterium that's responsible for this deadly human disease. So how does this toxin actually do its damage? It's a classic AB toxin. You can think of the B part as a key that picks the lock on our cells, letting the whole toxin sneak inside. Once it's in, the A part, the active, deadly piece, goes to work. It finds a crucial piece of our cell's machinery called elongation factor 2 and just shuts it down. This grinds all protein production to a halt, and without proteins, the cell simply dies. Okay, so we know the weapon. Now let's look at the trail of destruction it leaves behind. We're going to trace how this disease goes from a sore throat to a life-threatening, body-wide emergency. This really maps out the whole invasion perfectly. It all starts when the bacteria set up camp in the throat. Then, they start pumping out that toxin, which kills the surrounding cells. All that dead tissue, mixed with fibers and more bacteria, builds up to form that nasty pseudomembrane. And from there, the toxin gets absorbed into the blood, and that's when it goes looking for its next targets, your heart and your nerves. And here's a really clear look at that pseudomembrane we've been talking about. One of the key clues for doctors is that it's stuck on there, like really stuck. If you try to scrape it off, it actually causes bleeding. That little detail is a big red flag that helps distinguish it from something more common, like strep throat. In a really bad cases, you can see something called a bull neck. It's this dramatic, painful swelling caused by inflamed lymph nodes and tissues. It's a terrifying sign, really, because it tells doctors that there's a huge amount of toxin circulating in the body. So once that toxin is in the bloodstream, it can cause all sorts of devastating problems. But the #1 most serious complication is myocarditis, a dangerous inflammation of the heart muscle that can mess up your heart rhythm and lead to heart failure. The toxin also loves to attack the nervous system, which can cause paralysis, and it can even shut down the kidneys. And this is exactly why diphtheria is so feared. The toxin seems to have a special preference for heart tissue, and that myocarditis is, hands down, the leading cause of death from this disease. It's a silent killer that can hit even after the patient's throat seems to be getting better. So when you're up against a poison this powerful and this fast, how do you even begin to fight back? Well, it's not just a fight, it's an absolute race against the clock. Now, this is probably the single most important rule in managing diphtheria. The diagnosis has to be clinical. That means a doctor makes the call based on what they see, the sore throat, the fever, and especially that pseudomembrane. Why? Because once the toxin binds to a cell, the damage is done. It's irreversible. Waiting for a lab to confirm the diagnosis could be a fatal delay. Now, that's not to say lab tests aren't important. They absolutely are for confirming the diagnosis and for public health tracking. They'll take a throat swab, and they can use a special test called the Alex test, which you see here, to check if the bacteria they found are actually the toxin-producing kind. The response to a case of diphtheria has to be aggressive and immediate. You isolate the patient, protect their airway in case that membrane causes a blockage, and watch their heart like a hawk. But the two most important actions are giving antitoxin right away to neutralize the poison and then starting antibiotics to kill off the bacteria. And this right here is the lifesaver, diphtheria antitoxin. It's basically a dose of antibodies that act like a sponge, soaking up all the free-floating toxin in the blood before it can find and damage more cells. But remember, it can't fix damage that's already been done, which is why giving it early is everything. We've seen how nasty this disease is and how frantic the race to treat it can be. Which brings us to our last and honestly most important section. How do we make sure this never happens to begin with? Well, the answer is incredibly simple and incredibly effective. Vaccination. It's widespread immunization that turned this once common killer of children into a rare disease in many countries. When you're talking about diphtheria, an ounce of prevention is worth way more than a pound of cure. The DTaP vaccine is our shield. It works by teaching our immune system how to recognize and neutralize the diphtheriatoxin long before we're ever exposed to the real thing. But that protection doesn't last forever. Immunity can fade over the years, which is why getting booster shots is absolutely essential to stay protected for life. So what's the final verdict? Is diphtheria just a relic of the past, something we only read about, or is it a threat that could come roaring back if we let our guard down? Well, as we've seen, the bacteria and its toxin are still out there. The answer to that question really lies in vaccination.